AJ, plastic surgeon to the people of Birmingham and the surrounding suburbs. So that's the official title. So yeah, I've got some cues lined up. If you have any cues, then just get in the queue, and you might get an A from me. But if not, sit back, relax, and I will endeavour to answer the questions that have already been put forward to me, and we will see how we get on. So, if you don't mind, I will start with this one. It goes a little bit something like this. What happens if my cyst bursts before coming into clinic for my appointment? Good question. Like it. Good, strong start. Like it. Well, that is a good question, because that can sometimes happen with cysts. They can burst, they can get infected, they can discharge. And when they burst, it often looks like they've gone. So what would happen is that I would say to you, don't come to clinic. If it bursts, if the content is expelled, you'll probably think that it's gone, and so you'll probably have some kind of temporary relief. But sadly, it almost certainly will be temporary, because the cyst wall is still there. So they do tend to recur, but it would be actually quite hard to remove it with it burst, because it's kind of like an empty bag, and it's quite hard to find the cyst wall when it's burst. So we wouldn't do surgery on it when it's burst. We would kind of wait for it to recur, and you probably, I suspect, you might want to wait for it to recur anyway. Sort of psychologically, it's a bit weird if you've got a cyst and then it bursts and you think it's gone, to then go and sort of pay to have it removed, because you probably think that it's gone. So, but yeah, they tend not to go. They tend to recur, because we need to remove the cyst wall. But we need to wait for it to recur before we think about doing surgery. So yeah, if you are booked in for surgery and your cyst bursts, then cancel your op. Give us a ring, let us know, and we'll talk you through it. Oh, heck. Pinned a goal on TikTok. My iPad is old. All I do on the iPad is TikTok and Clash of Clans. And when I say TikTok, I mean this TikTok video that I make. I don't actually consume TikTok. I don't watch it. The only time I ever watch TikTok is in the 2 minutes before I do this Q&A, and it's always the same people. I don't know why. It's always the same people doing some fun. Look, they are again. Is that the same people doing so? Oh no, they're a bit different, but they're doing the same thing. They're just doing funny dance. Yeah, slightly different people, but I don't know why. Who's decided I want to be looking at these people? I mean, it's quite professionally done, to be fair, but I never kind of follow. Do you follow people? I don't know. Anyway, I'm back. So yeah, so back to the point. So that's all I use the iPad for, is the TikTok and the Clash of Clans, and it's just not. I can't cope. I need to probably I need to just clean it up. I thought I had cleaned it up, but it's just can't handle the bandwidth or whatever. So anyway, back on now. I'm not going to pin that again. I'm not going to touch it. Leave that alone. Sorry about that, TikTok. You haven't missed anything. So yeah, so if your cyst bursts before coming into clinic, then cancel the appointment, let us know, and we will reschedule it for a couple of months' time. Probably we'll just say to you, look, just give us a ring when it recurs. If and when it recurs, it might not recur. Be positive. Yeah, manifest that it's cured, but they usually do recur because the wall is still there. So what we got now is can cysts appear anywhere on the body? Yeah. Well, I mean, you're talking about skin cysts. So skin cysts, yeah, anywhere on the skin. I mean, you can get them elsewhere in your body. Obviously, you can get them in your liver and your spleen and your kidneys and your ovaries, and so you can get them inside in your brain. You can get them all over the place. But obviously, that's a different type of thing. So, but skin cysts, yeah, I think pretty much anywhere in the body. Yeah, just little blocked hair follicles which are all over the body. So I think so. I think yeah, anywhere in the body. Can multiple lipomas be removed at once? Yeah, and it's not uncommon to remove multiple lipomas at once. Probably we more commonly see people with solitary lipomas, but it's there are certain people who have a condition with multiple lipomas, and it's for sure possible to remove quite a lot. Often it will depend a bit on the anaesthetic. So if it's under local anaesthetic, we're limited as to how much anaesthetic we can use. Also, your tolerance, I suppose, of us, poking and prodding you, but within that limit under local anaesthetic, you can remove multiple, and certainly 8, 9, 10 is kind of, depending on the size. If they're big ones and they need a bit of dissection, you'd obviously need a little bit more local anaesthetic, so we'd be able to do fewer. And then if there were just little ones that are underneath the skin, because the little ones underneath the skin, they often kind of pop out. They often come out quite easily, so you can just do multiple. But you've got to be aware that you will have multiple scars if you are having multiple ones removed. So because often cosmetically you can't see lipomas, so you are actually potentially going to be worse off cosmetically if you're having multiple lipomas removed. So you've got to think about that. And obviously, if they're giving you symptoms, then you might say, yes, I don't mind having scars because they're annoying me, or they're painful, or they're uncomfortable, or whatever. But if they're not giving you any symptoms, you've got to think, do I want scars all over the place? Maybe I just want to get the big ones removed or certain ones removed. But on paper, yes, we can remove multiple lipomas at once. We certainly can do that on paper. That's for sure. Hold on. Can I get a shout out for Big James Kelly, who's down the beach in Turkey? Ripping. Okay. Don't think that's a question. Don't think that's a question, is it? No. Statement. Shout. I'm not sure. Who's that? Cruz. Shout outs. I'm not. Not been asked for a shout out before, Cruz. But shout out to James Kelly, who's on the beach in Turkey apparently. Not sure what the rest of it is, but anyway. Okay, thanks for that. All comments are gratefully received. Okay, back to the plastic surgery questions, which is kind of like the focus of what do different skin types scar differently? Yes, they do. So first of all, I wouldn't say if you've got a certain skin type, you are definitely going to get a certain type of scar. So yes, they do scar differently, but it's not the case that you can predict how you're going to scar based on your skin type, if that makes sense. But broadly speaking, there are certain skin types which have certain traits. So people with quite pale skin tend to develop more red scar. The scar is red, more red and redder for longer. The paler your skin, the more chance you're going to have a red scar, which is going to be red for longer and may take longer to fade. The darker skin types, so Afro-Caribbean skins, do have a risk of forming hypertrophic or keloid scars. That doesn't mean they'll definitely form them. It's just increased risk in Afro-Caribbean skin types. So that is an issue. I know it's not skin types, but in terms of kind of patient ages, young people tend to scar worse than old people from a cosmetic point of view, how the scar looks. So the scar will often look worse on a young people than it will on a young person than it will on an old person. not least because old people often have lines and wrinkles and crinkles and places we can hide scars, whereas young people tend not to have them. But aside from that, also the scars are more red, don't fade quite as quickly. But on the flip side, young people heal better than old people. So young people tend to heal more quickly than old people. There's a risk of a delayed healing that in older people. Young people tend to heal better. So there's an age thing and there's also a skin type thing. But as I say, just because you've got a certain skin type doesn't mean that we can predict how you're going to scar. But we would say, look, you're at a risk of either a red scar or a hypertrophic or keloid scar. So it's something to discuss if someone's having surgery to put in the mix in terms of informed consent as to whether you have surgery or not. Can lipomas turn cancerous? Well, yes, they can, but I don't want to scaremonger because it's extremely rare. So you can get something called a liposarcoma, which is a cancerous lipoma. Worrying signs would be it's kind of a lipoma that's unusual, that's maybe hard, craggy, painful. Having said that, there is a type of benign lipoma called an angiolipoma, which is often painful or should we say uncomfortable, which is benign. So just because it's painful doesn't necessarily mean that it's cancerous at all. But there will be signs that we will be thinking, hold on, rapidly changing in size. These sorts of things are kind of worrying signs. But I would say that a liposarcoma, I can't remember ever seeing a liposarcoma. I might have done, but I can't remember ever seeing one. So it's certainly not a common occurrence, but it's definitely on paper a risk. But if you've got a lipoma, I wouldn't go thinking, crikey, could it be a liposarcoma? Because that would be an extremely rare thing to happen. But rare things happen. But I would say that it's not high on the list. Usually people have them removed because they're uncomfortable, or they got functional things that they're getting in the way, or they just don't like having a lump there. So, Michelle Mary's liked the live. Thank you for liking the live. Shout out, yeah, another shout out. Any more shout outs? Shouts outs. Do I need a plastic surgeon to remove my face mold if I have a keloid skin? So if you have a keloid skin, so by that I assume that means that you have had a keloid scar before, rather than just the fact that you've just got Afro-Caribbean skin type. So if you have had a keloid scar before, then that is a worry, because that might mean that you're going to get another keloid scar. Now, the sort of questions I'd be asking is what the circumstances of your previous keloid scar. So if there were things like delayed healing or certain areas like the shoulder, the sternum, these areas are high risk areas for keloid scar, that would make me feel better, that I would say you're less likely of getting another keloid scar if there's a reason or a contributing factor to the last one becoming keloid. So, as I say, delayed healing, so especially if it's over 3 weeks, or high risk area, shoulder, sternum, earlobes. These are high risk area for keloids. If you have a strong history of keloid, if you've had scars in other parts of your body that have become keloid, and certainly if you've got a family history of keloid, then I'd be a bit more anxious about it, and I would probably be questioning having that mole removed and thinking why you want the mole removed. Rather than saying you need a plastic surgeon, I would probably be saying you kind of want to avoid any surgeon really, because if it's for cosmetic reasons, you've got to think, cosmetically speaking, if I get a keloid scar, that's going to be worse than the mole. Obviously, if it's a worry, if you think it might be a skin cancer, then fair enough, then we need to remove it. Do you need a plastic surgeon to remove it? Maybe. I don't know whether Another sort of doctor would remove it, a dermatologist or what have you. But you know, the things you want to be trying to do is minimize the scar. But if you are worried about skin cancer, then you've got to balance that against making sure you remove all of the mole. So there's a balance to be had there. And placement of the scar, you know, that's something we do work hard at. So, you know, when you've got a mole, you have to place the scar where the mole is, but sometimes we can do a nuance to move the scar slightly one way or the other, or angle it in a certain way to make it slightly less obvious. So there are things we do to try and minimize the scarring, but there's not an awful lot we can do to reduce the chance of you getting a keloid scar. If you're going to get a keloid scar, you're going to get a keloid scar. There's a few things we can do, but not much we can do to reduce that. And it might sound glib, but the most effective way to stop getting a keloid scar is to not get a scar. So don't have a scar. Don't have a surgery. Basically, keep your mole. So as I say, if you're worried it's a cancer, that's a different story. But if it's just the look of it you don't like, and you've got a history of keloid scarring, I would be worried about doing that. I would be worried about taking it off your face. Although, having said that, keloids on the face are rare. Kiki, you just asked me to join the co-host or something. I'm assuming that's an error. Usually is an error. If it's not an error, let me know and I'll do that. Yeah, my advice is to think hard about having surgery at all, plastic surgeon or no plastic surgeon. But if you are going to have surgery, then maybe a plastic surgeon would be beneficial. I mean, to be honest, I think having a mole on your face removed by a plastic surgeon is going to be better than another, maybe someone who's not familiar with doing stuff on the face. But yeah, there's not an awful lot we can do to not give you keloid. Although there are things we can do to treat it. We do treat keloids if they occur, and obviously that's something that we should look out for. So we've got Liz has asked a question. So that's more better than another shout out. So what we want questions. Yeah, let's all follow Liz's lead. My daughter's scar is red and raised. Any tips? Yeah. So as I said earlier, I don't know if you were here, but younger people do tend to scar worse than older people in terms of redness and what have you, so it can take a while for the redness to fade. So I guess the first thing is to say try not to worry too much about it, because it may well get better, and it often takes a year or more for it to properly settle. So once it's here, so first thing I would say, how's the scar been formed? Is it sort of surgical scar or was it trauma? Because if it was a surgical scar, I'd say talk to the surgeon to talk about post-op regime, because I don't want to sort of tell you something that's against what your surgeon says. But personally, what I say with scars is I wait for them to heal. So I don't do anything for 6 weeks. So assuming it's healed, the wound is healed, if it's red and raised, the main modality of scar management, in my view, is moisturizer massage. Oh, the moil you removed for her in February. Okay, so I removed it. Okay. Right, okay, Liz. Nice one. Well, she can come in, Liz. She can come in and send the photo in. Right, okay. February, right, we're now. So that's, okay, so we're 6 months, are we? 7 months, something like that. Okay, so the main thing is moisturizer massage. That's the main sort of modality of managing scars. You've got to be a bit careful in the sun. We're out of the woods on that one now because there's not so much sun going on, but certainly if she's going on holiday. But moisturizer massage is the main modality. If the other thing you can think about is silicone, which can come as a sheet or a gel. If it's on the face, did you say it was on the face? Or did you not say? If it's on the face, can't find it now. But anyway, if it is on the face, then maybe the gel's better. But on the body, often the sheets are good. But either way, silicone can help with red raised scar. That's a red raised scar. It'd be something we'd be calling a chest. Oh yeah, well, chest is a bad area. Did I remove a mole of the chest? I hope I warned her that they can go red and raised on the chest. If it is a hypertrophic scar, which is what a red raised scar at 6 months would, I guess, class as a hypertrophic scar. So that sounds like it's a hypertrophic scar. So the silicone can help. If on the chest, often the sheets can help. Put the sheet on. You can't do moisturizer massage and the silicone. You have to do one or the other, because if you put the silicone on your massage, you obviously rub the silicone off. So that's something that she could try. That can just be bought in the chemist. You don't need a prescription or anything like that. But having said that, you're always welcome to come in or send a photo, Liz. Did I know that the scar's red? Send us a photo. She's tried the sheets. Okay. The next step, Liz, is steroid injection. So if it is a hypertrophic scar, so I'm just saying in general terms now, specifically for you, Liz, send us a photo and I'll tell you specifically what we need to do about this one. But in general terms, for red raised scars, the next step would be steroid injections. We do that at the clinic, and that's injecting into the scar, and that can help with the redness, can help with the red raised nature, and they're often itchy. I don't know if it's itchy, but the steroid can really help with the itch. So the steroid can really help. Sometimes you need to repeat it. So that's kind of like the next stage. And then after that, we probably wouldn't do anything till at least a year later, when you can think about doing things like, probably not for your daughter, Liz, but we do things like intralesional excisions and things when you get lumpy scars. But you've got to be really careful doing surgery to fix a surgical scar, because obviously that could potentially make it worse. The main thing is time, so at least a year really for it to properly settle. But the steroid might be an option, Liz. So give us a ring or send us an email or a photo or something, and we can certainly look at potentially doing some steroid injections. It can be very effective for red raised scars. But the things to try before that are the sheets and the massage. If the sheets haven't worked, then moisturize and massage. And by massage, I mean pressure. So make it blanch, make it go white. If it, give it actual pressure, assuming it's not tender, which it shouldn't be for this far down the line. So a little bit of pressure, make it go white, and really trying to break down that scar tissue. So that's something that you can try if the sheets aren't doing the trick. So yes, tell her to send us a picture, Liz. Super dupes. So yeah. Well, can she put one up here? She probably can't put one up here, can she? Right. Thank you for that, Liz. And I personally am out of questions on a personal level. So I will. Obviously I'm a busy man, so I've obviously got quite a lot to do. So I'm going to go next door and do stuff. So if that's all, I will bid you good night. Bid you farewell. Thanks for participation there, Liz. Always nice to have old friends. And no, and my daughter's not here. My daughter was here. Yes, we were watching Bake Off, but she's not here. So no, I can't do it. Can't do it. It's not for me. But yeah. But Liz, by all means, you go and watch Bake Off, and I will see you same time, same place next week. And in the meantime, give us a call or give us a message for the photo, Liz. So hasta la vista. I'm stopping a stream. You've been warned. The stream